Hello, my name is Shauna and I'll be your nurse today. We'll be doing a peripheral, vascular, and lymphatic system assessment today. First, I'm going to provide you with some privacy. Next, I'm going to wash my hands and put on gloves. Can you verify your name and date of birth for me?
Mackenzie Richards, 04-19-1999.
Thank you. To start off our assessment today, I'm going to start with inspecting and palpating your arm. Alright, looking at color and size, your color is equal between both arms. Your size is bilaterally symmetrical. Alright, your texture is smooth, no edema or lesions. The temperature, they are warm to the touch, bilaterally equal. Next, I'm going to check your turgor to see if you are dehydrated. Alright, your color returns less than 1 to 2 seconds, which is a normal finding. That means your skin is hydrated. So next, I will be checking your pulses at your radial and brachial side on both arms. Alright, your radial pulse is about a 2+ on both arms. They were even, no signs of hyperkinetics or a weak pulse. Next, I'm going to check the bridge. Your brachial pulse on both arms are also a 2+. Your rate and rhythm at all sites were equal. They were good. They were symmetrical. No signs of hyperkinetic, which is too fast of a pulse, or a weak pulse. Next, I'm going to palpate your epitrochlear node, which will be by your brachial site. I'll be palpating both arms. Alright, on both arms, those nodes were not palpable, which is actually a normal finding. That's a sign that there are no masses, nor is there an infection anywhere from your wrist to that node. So those are all normal findings. Next, I'm going to move down to your leg, and I will be inspecting and palpating those as well. But before I start, I will sanitize my hands. Okay, and then your pants are already above the knee for me. Thank you. So I would start with looking at your color and size. The color between both legs are congruent to each other. They're even within both. Alright, the size is bilaterally symmetrical. Everything looks good. Next, I'm going to check the temperature. Alright, your temperature, your legs are warm to the touch. The temperature is equal between both legs. Now I'm going to look at your hair distribution and the texture of your legs. The hair looks thin but evenly distributed on both legs. Your skin is also smooth, which is good. I will note a couple of scars and bruises, but you do play a sport, so those are normal findings. Alright. Next, I'm going to palpate your popliteal pulse. This is actually on the back of your knee. If you can lay on your stomach for me, please. I'm gonna bend this real quick.
Hey, y'all aren't filming right now, right?
Alright. check the, the pulse on the other leg. Alright, the pulse was noted in both legs. They were both about a 2+. The rate and rhythm was equal. No, nothing abnormal found there. You can sit back up. Alright, next I'm going to check for your venous patterns, which is the change in color of your legs when you stand. You can stand up for me. Alright. Your venous pattern looks good. I do not note any color change in the legs when you stand. Alright, so that's all good, all normal findings. Next, I will be, normally at this time we would palpate your inguinal node, which is in your groin, and your femoral pulse, which is also in the groin area, but we will not be doing that today. When we do that, we just make sure your pulse is a 2+, nothing irregular, no hyperkinetics or weak pulse. And then with palpating the node, we would be looking for that edema, masses, and anything else irregular like that, but we will not be doing that today. So next, I will be palpating your posterior tibial artery, and then I will also be checking your inner ankle for that pulse. Alright, everything feels good, no masses. Check the other leg as well. Alright, I do not note any masses, nor is there any edema present. I will now be checking that pulse on both insides of your ankles. You can relax your leg for me, please. Alright. Alright. Your pulse was detected in both ankles. They are both a 2+, and the rate and rhythm was symmetrical to each other. So no abnormal findings there. Lastly, I will be palpating for the dorsi pulse, which will be on the top of your feet. Alright, next book please. Alright, your pulse is also detected in both feet. They're both at a 2+. Your rate and rhythm were equal bilaterally. The location was symmetrical. Everything looks good. No abnormalities were found there. Within all of your pulses, none of them are hyperkinetic or weak. You had a 2+ overall, and no other abnormalities were found. Thank you.